Welcome to Get Fitness Success, where we learn about our body, mind, and spirit. This video does not replace expert medical advice. Ask a doctor if you have any questions. Please subscribe, like, and comment. I appreciate your support. In this video, we will learn about celiac disease symptoms and treatment, what celiac disease is, and how does it affect you. Let's begin. Celiac disease is a digestive ailment characterized by an immune response to gluten that is aberrant. Celiac disease is also known by the following terms: sprue, non-tropical sprue, and gluten-sensitive enteropathy. Gluten is a protein found in wheat, barley, rye, and triticale products. It's also found in oats that have been processed with other grains. Gluten can be present in a variety of products, including pharmaceuticals, vitamins, and cosmetics. Gluten intolerance, commonly referred to as gluten-related illnesses, is defined by symptoms that occur after consuming gluten-containing foods. Non-celiac gluten sensitivity is minor gluten sensitivity, whereas celiac disease is autoimmune. The body is unable to absorb nutrients from meals when the villi are destroyed. This can result in malnutrition as well as other major health issues, such as irreversible intestinal damage. Celiac disease affects around 1 in every 141 Americans, according to the National Institute of Diabetes and Digestive and Kidney Diseases. Celiac disease patients must avoid all kinds of gluten in their diet. Most breads, baked items, beer, and foods containing gluten as a stabilizing element fall under this category. Celiac disease is an autoimmune disorder in which people are unable to consume gluten due to damage to their small intestine. When you have celiac disease and consume gluten-containing foods, your immune system reacts by causing damage to the small intestine. Each person with celiac disease is affected differently. Symptoms might manifest in the digestive tract or elsewhere in the body. Some persons have no signs or symptoms. Celiac disease is a hereditary condition. Blood testing can assist your doctor in making a diagnosis. A little piece of tissue from your small intestine may also be required for examination by your doctor. A gluten-free diet is used to treat the condition. When a person with celiac disease consumes gluten, their body overreacts to the protein, causing damage to their villi, which are little finger-like projections found along the small intestine's wall. If your villi are injured, your small intestine can't absorb nutrients from meals correctly. This can eventually lead to malnutrition, bone loss, miscarriage, infertility, and even neurological illnesses or malignancies. It's considered non-responsive celiac disease if your celiac disease hasn't improved after at least a year without gluten. The majority of people with celiac disease are completely unaware of their condition. According to researchers, only about 20% of people with the condition receive the correct diagnosis. The damage to your gut is gradual, and the symptoms are so variable that a diagnosis might take years. Gluten intolerance or gluten sensitivity are not the same as celiac disease. Some of the symptoms of gluten intolerance are similar, and people who are gluten intolerant may want to avoid it. However, they do not show any signs of an immunological response or damage to the small intestine. How can you know if you have celiac disease? Symptoms of celiac disease usually affect the intestines and digestive system, but they can also affect other regions of the body. Celiac disease symptoms vary greatly, and a person may experience various symptoms that come and go. You may experience stomach issues or other symptoms if you have celiac disease. Children are more likely than adults to experience digestive issues. Bloating, chronic diarrhea, constipation, gas, lactose intolerance due to small intestine damage, loose, greasy, bulky, foul-smelling stool, nausea or vomiting, and abdominal discomfort are digestive symptoms of celiac disease. Symptoms, in most cases, also affect other parts of the body. Iron deficiency anemia, joint pain and stiffness, weak, brittle bones, fatigue, seizures, skin disorders, numbness and tingling in the hands and feet, tooth discoloration or loss of enamel, pale sores inside the mouth, irregular menstrual periods, infertility, and miscarriage are just a few of the signs and symptoms. Another typical symptom of celiac disease is dermatitis herpetiformis. DH is a rash with bumps and blisters that is extremely itchy. Elbows, buttocks, and knees may be affected. About 15 to 25% of celiac disease patients have DH. The majority of people who have DH don't have any stomach problems. It's crucial to remember that symptoms differ from person to person depending on a variety of circumstances, including how long someone was breastfed as a child, when they first started consuming gluten, how much gluten they eat, and the severity of their intestinal damage. Celiac disease affects some people without causing any symptoms. They may, however, experience long-term consequences as a result of their sickness. If you suspect you or your kid has celiac disease, make an appointment with your doctor. Complications are more likely to emerge when diagnosis and treatment are delayed. What's the difference between celiac disease and gluten sensitivity? The small intestine is damaged with celiac disease. Blood tests reveal certain indicators that aid in diagnostic confirmation. Symptoms of non-celiac gluten sensitivity include nausea, vomiting, abdominal pain, headaches, diarrhea, joint pain, fatigue, and brain fog, which can be mild or severe. However, gluten sensitivity does not cause damage to the intestine. There are no specific markers in the blood, and the diagnosis requires improvement of symptoms after a gluten-free diet. According to research, celiac disease mainly affects people with particular genes and eat gluten-containing foods. Still, experts are looking at other factors that may play a role in the disease's development. Celiac disease nearly always affects people who have one of two groups of normal gene variants termed DQ2 and DQ8, which are exceedingly rare in people who do not have these gene variants. About 30% of people have DQ2 or DQ8, but only about 3% of those with DQ2 or DQ8 develop celiac disease. Other genes that may raise the risk of celiac disease in people with DQ2 or DQ8 are being investigated by researchers. Celiac disease is caused by an abnormal immune system response triggered by gluten consumption. However, not everyone with the gene variants DQ2 or DQ8 who eat gluten develops the disease. Research suggests that children with a genetic predisposition for celiac disease who eat more gluten in early childhood have a higher risk. Other factors being researched include a higher number of infections in early life, certain digestive tract infections, and changes in the microbiome. Experts also believe changes in the microbiome could play a role in the development of celiac disease. Celiac disease has no known cause. It runs in families and may be linked to particular genes. It can be triggered by stressful medical events such as a viral infection, or surgery, and emotional trauma, or pregnancy. You have a 1 in 10 chance of having celiac disease if a close relative, such as a parent or sibling, has it. The disease is particularly common in Caucasians and people who have other illnesses, such as, but not limited to, Hashimoto's thyroiditis, type 1 diabetes, Addison's disease, Down syndrome, rheumatoid arthritis, Turner syndrome, multiple sclerosis, autoimmune hepatitis, scleroderma, Williams syndrome, primary biliary cirrhosis, lactose intolerance, intestinal lymphoma, and intestinal cancer. If you don't get treatment for celiac disease, it can be fatal. Among the potential complications are cancer, including intestinal lymphoma and small bowel cancer, damaged tooth enamel, infertility and miscarriage, lactose intolerance, malnutrition, nervous system problems like seizures or pain and numbness in your hands and feet, known as peripheral neuropathy, pancreatic disease, and weak bones. If your doctor suspects you have celiac disease, they will do a thorough physical examination and talk to you about your medical history. The provider may also perform a blood test to assess gluten antibody levels. Celiac disease patients have greater amounts of certain antibodies in their blood. A genetic test for celiac disease in the blood may be required in some cases. Other tests, such as a blood test to determine iron levels, may be performed by your provider to screen for nutritional deficiencies. A biopsy of your small intestine may be taken to look for damage to the villi. An endoscope is inserted via your mouth and into your small intestine, and an instrument is used to take a sample of the small intestine. To avoid any discomfort during the surgery, sedation or anesthetic is used. Doctors use blood testing and other tests to determine if you have celiac disease. Swallowing a small camera can show problems in your digestive tract. Imaging tests show signs in the intestine, like wall thickening or changes to blood vessels. Genetic testing looks for human leukocyte antigens to rule out celiac disease. If you're on a gluten-free diet, you'll need to stop before the antibody test to ensure accurate findings. If blood testing and other tests indicate that you may have celiac disease, you'll almost certainly need an endoscopy. Your doctor can examine your small intestine and collect a tissue sample to evaluate if it's harmed during this treatment. Doctors will take a small sample of your skin if you have a rash to check for evidence of celiac disease. This rash is easily mistaken for various skin conditions. You can't eat gluten-containing foods if you have celiac disease, including wheat, rye, and barley. You will be advised to see a nutritionist for more formal diet advice. In most cases, eliminating gluten from your diet improves your condition within a few days and finally eliminates the disease's symptoms. On the other hand, the villi usually take months to years to recover. An adult's intestines may take 2 to 3 years to heal, compared to roughly 6 months for a youngster. You'll need to see a doctor on a regular basis, and you'll have to stick to this diet for the rest of your life. Even a small amount of gluten can cause damage to your intestine and cause the problem to resurface. You can't consume several staples if you're on a gluten-free diet, such as pasta, cereals, and many processed items that contain gluten. Gluten can also be found in food additives that increase texture or flavor, and some medicines. Ice cream and salad dressing are two less obvious sources of gluten. Another common source of gluten is cross-contamination, which occurs when gluten-free foods come into contact with gluten by accident. You can still eat a well-balanced diet if you have celiac disease. For example, bread and pasta made from other flours are available. Gluten-free bread and items are also available from several food manufacturers and supermarket stores. You can also eat gluten-free fresh items that have not been artificially processed, such as fruits, vegetables, meats, and seafood. No drugs treat celiac disease. The best thing you can do is change your diet. Unless they're labeled as gluten-free, don't eat foods that are typically made with grains, including beer, bread, cake, and other baked goods, cereals, pasta or noodles, crackers, breading, pancakes, sauces, and gravies. These grains always have gluten: wheat, wheatberries, durum, semolina, spelt, farina, farro, graham, einkorn wheat, rye, barley, malt, brewer's yeast, wheat starch. People living with celiac disease should read labels carefully. Gluten can be found in a variety of processed foods: granola or energy bars, French fries, potato chips, lunch meats, candy or candy bars, soup, salad dressings and marinades, meat substitutes such as veggie burgers, and soy sauce. You can trust the following foods are always gluten-free: fruits, vegetables, meat and poultry, fish and other seafood, beans and nuts, and dairy. Gluten-free starches and grains include rice, corn or maize, soy, potato, tapioca, beans, sorghum, quinoa, millet, amaranth, flax, chia, nut flours. Gluten can be found in everyday items like pharmaceuticals and toothpastes, so read the labels carefully. If you are severely deficient in nutrients, your doctor may prescribe gluten-free vitamins and minerals, as well as treatment if you have a skin rash. Your small intestine should start to recover after a few weeks on a gluten-free diet, and you'll start to feel better. Celiac disease is unavoidable. Early detection and therapy of celiac disease, on the other hand, may help to avoid serious problems. As a result, it's critical to screen for celiac disease in people who are at a higher risk of developing it, such as first-degree relatives of celiac disease sufferers. The prognosis is excellent after sufficient treatment and diligent medical follow-up. People who are not treated or do not react to treatment may experience some medical problems or possibly die sooner than is deemed normal. On the other hand, celiac illness is rarely fatal. Most diagnosed people avoid gluten. A gluten-free diet will need a significant adjustment in your lifestyle. You need to reconsider your eating habits, including what you eat for lunch, during events, and as a snack. Read the ingredient labels carefully to avoid accidentally ingesting gluten if you're going grocery shopping. If you are unsure about the gluten content after reading the labels, it is not safe for you. You can get gluten-free diet advice from a dietitian, a healthcare practitioner specializing in food and nutrition. Patients who have recently been diagnosed with celiac disease can also benefit from support groups. If you've watched this far, please like and subscribe. Now, go get fit.